we will discuss about heart failure. A lot of cases in ICU and ward setups, we will be seeing the cases of heart failure. So it is very, very important to understand the pathophysiology before we consider treatment options. So let's discuss about the pathophysiology today. So whenever there is heart failure, mainly first I want to talk about heart failure with reduced ejection fraction. So whenever there is heart failure, there will be decreased cardiac output, which will lead to what? Two important things, that is decreased blood supply to carotid baroreceptors, and the same decreased cardiac output will lead to decreased blood flow to kidneys mainly. So these are the two things which will play the important role in the pathophysiology. Now when there is decreased blood supply to the carotid baroreceptors, it will lead to what? Activation of the sympathetic system. So then what happens? It will lead to increased heart rate and mainly vasoconstriction. So what's happening here? So increased heart rate and vasoconstriction will lead to increased venous return to the heart. So overall what's happening? It is trying to increase the cardiac output through increasing heart rate and increasing the stroke volume. And on the other side, whenever there is decreased blood flow to the kidneys, there will be activation of the RAS, which will lead to increased levels of angiotensin 2. So as the name indicates, angiotensin, this will mainly cause arterial vasoconstriction and reduced GFR. So arterial vasoconstriction again will lead to what? Increased peripheral vascular resistance. That is nothing but it will try to increase diastolic blood pressure also. And by decreasing GFR, it is trying to conserve fluid in the body, thus trying to compensate for decreased cardiac output. So after all these effects, we will get, there will be increased heart rate, increased venous return, increased peripheral vascular resistance. So overall, they are all trying to increase the cardiac output. So at this stage, heart is trying to improve the cardiac output by itself. This stage, we call it as compensated heart failure. But on prolonged situation of the same kind, it will lead to failure of all this system. That will lead to decompensation. So that is decompensation. And here one more important thing is, this decreased blood flow to the kidneys will also lead to increased aldosterone levels. So this aldosterone is the important factor which on a long run will lead to multiple changes in the cardiac structures. For example, it will lead to endothelial dysfunction and myocardial fibrosis. Overall, all these things will lead to cardiac remodeling, which will be harmful if it runs for longer duration. And one more important thing, so we discussed about the activation of sympathetic system, and second one is activation of RAS. Third one is there is increased aldosterone, which is again leading to myocardial fibrosis and all. Fourth important thing is there will be release of ANP and BNP peptides. So this is actually helpful because it will lead to volume decongestion. Also, it will lead to vasodilation, which will be helpful in heart failure. So these are the four important things. So when we are trying to treat a case of heart failure, we have to focus on these things. So what will be our proper medications for a heart failure patient? First, we have to handle this increased sympathetic system. So how do we handle? We will use what? Beta blockers. So for this, beta blockers are helpful. So first drug is beta blocker. So it will lead to control of the heart rate. Next one is, we have to target RAS. So for that, angiotensin 2 receptor blockers, that is ARBs or ACE inhibitors, should be there in the list of medications of heart failure. This is number 2. Third one is aldosterone antagonists, that is aldactone. So third one is aldactone, that is aldosterone antagonist. Fourth one is, we have to maintain ANP and BNP levels. So there will be lysis of these peptides by naprolysin. So we have to inhibit that enzyme. So for that we can use ARNI. And there is one more newer drug which will be used everywhere nowadays, that is dapagliflozin. You might have heard about it. SGLT2 inhibitors. So that is again a pillar for heart failure medications that will act through multiple mechanisms which will help in case of heart failure. So these are the medications which we have to use in case of heart failure with reduced ejection fraction. Thank you.